Which of the following conditions can be triggered by Rh incompatibility between mother and fetus? A. Hyperemesis gravidarum. B. Preeclampsia. C. Hemolytic disease of the newborn. D. Postpartum hemorrhage. E. Gestational diabetes. The answer is C. Hemolytic disease of the newborn. Of the conditions listed, the only one that is associated with Rh incompatibility between mother and fetus is hemolytic disease of the newborn, otherwise known as hemolytic disease of the fetus and newborn. In this condition, antibodies from the mother's blood attack the blood of the fetus. This is a major cause of fetal and newborn mortality and morbidity. Which of the following maternal, fetal blood types can lead to hemolytic disease of the newborn? A. Rh positive mother, Rh positive fetus. B. Rh negative mother, Rh negative fetus. C. Rh negative mother, Rh positive fetus. D. Rh positive mother, Rh negative fetus. The answer is C. Rh negative mother, Rh positive fetus. Hemolytic disease of the newborn occurs when an Rh negative mother is carrying an Rh positive fetus. The mother must have previously carried an Rh positive fetus and become sensitized to Rhd antigen during miscarriage, pregnancy, due to placental rupture, or during delivery. Then, during a second pregnancy, anti-Rhd antibodies from the mother's immune system can cross the placenta and attack the blood cells of the fetus, causing hemolytic anemia. What treatment can prevent the development of sensitization to Rhd antigen in an Rh negative mother carrying an Rh positive fetus? A. Therapeutic abortion. B. Rhd fetal serum injections. C. Short course immunosuppressant treatment. D. RHO, D, immune globulin. The answer is D. RHO immune globulin. Rh sensitization can be prevented by treatment of an Rh negative mother with RHOD, immunoglobulin at 28 weeks. Then again within 72 hours of delivery. This is a solution of IgG antibody to Rhd, which is able to destroy any fetal red blood cells that enter the mother's bloodstream before her own immune system is able to develop a sensitization. A nurse working in labor and delivery is caring for a client that has been diagnosed with an incompetent cervix. The client has been informed by the physician she is now at risk for a spontaneous abortion. The client asks the nurse about possible interventions. The nurse is aware the procedure performed for an incompetent cervix is called A. McCarrine-Olds procedure. B. Shirodker procedure. C. Colbripy. D. Dilation and curettage. E. Tubal ligation. The answer is B. Shirodker procedure. A Shirodker procedure involves sewing a suture in and around the cervix to hold it closed. This is usually performed within the first trimester and later removed when the risk of miscarriage has lessened. A pregnant woman at 43 weeks gestation is having labor augmented with oxytocin infusion. Which of the following best categorizes this particular drug? A. Prolactin. B. Antidiuretic hormone. C. Growth hormone. D. Erythropoietin. E. Thyroid stimulating hormone. The answer is B. Antidiuretic hormone. Oxytocin is often used to help augment labor by inducing contractions. This hormone is naturally made in the body and works as an antidiuretic hormone, thus promotes the excretion of water. In labor, this hormone also works to stimulate uterine contractility. You are the nurse taking care of a 76-year-old female who complains of vaginal dryness that is occasionally painful during intercourse. She is diagnosed with vulvovaginal atrophy. Which of the following is the best initial treatment? A. Systemic estrogen. B. Diphenhydramine. C. Propranolol. D. Topical estrogen. E. Oxybutynin. The answer is D. Topical estrogen. In a patient with atrophic vulvovaginitis, a condition that causes thinning of the vaginal and vulvar tissue, resulting in inflammation, diminished lubrication, and subsequent pain, the best initial treatment option if the condition is distressing to the patient is application of topical estrogen. Atrophic vulvovaginitis is a common condition in postmenopausal women as the level of circulating estrogen decreases, and therefore estrogen-mediated effects on female tissues are diminished. With the significant decrease in estrogen to the vagina and vulva, inflammatory and painful symptoms may occur, as in this patient. By applying a topical estrogen cream to the affected tissues, this allows the patient to supplement the estrogen that was lost following menopause, while not exposing the patient to the potentially negative effects, for example cardiovascular, of systemic estrogen supplementation. Propranolol is a beta-adrenergic antagonist and has no role in the treatment of atrophic vulvovaginitis. Oxybutynin is an anticholinergic medication that is used to treat spastic bladder, among other conditions. It has no role in the treatment of atrophic vulvovaginitis. Diphenhydramine is an antihistamine medication that has a wide variety of uses, but none known to treat atrophic vulvovaginitis. You are the nurse taking care of a 28-year-old G3P2 who is at 33 weeks gestation. She goes into labor, and the physician orders administration of a tocolytic medication. Which of the following medications is a tocolytic? A. Sertraline. B. Terbinafine. C. Lisinopril. D. Furosemide. E. Terbitalin. The answer is E. Terbitalin. A beta-2 adrenergic agonist, is the only medication listed that has tocolytic, or labor-repressing, anti-contraction, properties. It is one of the most common medications used for tocolysis in pregnant women. Another commonly used tocolytic agent is nifedipine, a calcium channel blocker. The other choices are incorrect. Lisinopril is an angiotensin-converting enzyme inhibitor, ACEI, that is commonly used to treat hypertension, among other conditions. It has no reported use as a tocolytic. Furosemide is a loop diuretic that is commonly used in the treatment of hypertension. It has no reported tocolytic properties. Sertraline is a selective serotonin reuptake inhibitor medication used to treat a number of conditions including major depressive disorder and generalized anxiety disorder, among others. Terbinafine is an allopurinol antifungal medication used to treat conditions such as tinea corporis or tinea cruris. Basal body temperature is determined by dash. A. Taking the temperature before bed. B. Taking the temperature in the afternoon. C. Taking the temperature in the evening. D. Taking the temperature mid-morning. E. Taking the temperature before rising. The answer is E. Taking the temperature before rising. The basal body temperature is a method many women use to determine when ovulation occurs. To take a basal body temperature, One must use a basal thermometer, which is more sensitive, and take their body temperature before getting out of bed, or even sitting up, each morning. This method is utilized the best if a woman wakes up and takes her temperature at the same time daily. A nursing student is participating in clinical practice on a labor and delivery unit. He is learning how to measure contractions. He knows that contractions are measured by frequency, duration, and intensity. Which time frame correctly describes how the student should measure the frequency of contractions? A. The increment of the first contraction to the decrement of the second. B. The increment of the first contraction to the decrement of the first. C. The increment of the first contraction to the increment of the second. D. The acme of the first contraction to the acme of the second. E. The increment of the first contraction to the acme of the second. The answer is C. The increment of the first contraction to the increment of the second. Increment is the beginning or rise of the contraction. Acme is the peak of the contraction. Decrement is the fall of the contraction. Frequency is measured from the beginning of one contraction to the beginning of another, so it should be measured from the increment of the first contraction to the increment of the second contraction. While caring for a laboring patient, the nurse is called into the room because her patient felt a gush of fluid. Which of the following should be the nurse's next action? A. Turn the mother to her right side. B. Alert the physician. C. Assess fetal heart rate. D. Change the sheets. E. Inform the mother of what she should expect next. The answer is C. Assess fetal heart rate. The nurse must suspect rupture of the membranes, amniotic sac. Assess fetal heart rate if rupture of the membranes may have occurred. With rupture comes the potential for cord prolapse. Assess fetal heart rate for baseline variability. Marked variability may be cause for concern and the nurse should monitor the patient for signs of infection. Which of the following symptoms is not a danger sign of pregnancy? A. Fever or chills. B. Persistent vomiting. C. Increased urination. D. Vaginal bleeding. E. Swelling in face or fingers. The answer is C. Increased urination. It is important for the obstetric registered nurse to recognize the following danger signs of pregnancy: profuse vaginal bleeding, severe headaches, visual disturbances, abdominal pain, persistent vomiting, fever, chills, or swelling in the face or fingers. These may be signs of placental abnormalities, hypertensive disorders or pregnancy, maternal infection, or hyperemesis. Increased urination may be concerning to some women, but during pregnancy, the increased mass of the uterus induces pressure upon the bladder. Which of the following tests may be used to assess the risk for neural tube defects in the fetus during pregnancy? A. Alpha fetal protein, AFP, test. B. Ultrasound. C. Non-stress test, NST. D. Chorionic villus sampling, CVS. E. Amniocentesis. The answer is A. Alpha fetal protein, AFP, test. The alpha fetal protein test is the only test that can predict neural tube defects in a fetus during pregnancy. CVS can detect fetal karyotype, sickle cell anemia, phenylketonuria, PKU, Down syndrome, and Duchenne muscular dystrophy. Amniocentesis can detect genetic disorders and lung maturity. Ultrasounds provide images of the fetal position, measurements of the fetus and placenta, and can confirm pregnancy and gestational age. Non-stress tests, NST, are used to record fetal heart rate to assess fetal well-being after 28 weeks gestation. What is the proper management of atypical squamous cells of undetermined significance, ASCUS, or low-grade intraepithelial lesion, LSIL, in women aged 21 to 24? A. Cervical conization. B. LEEP, loop electrosurgical excision procedure. C. Repeat cytology in 1 year. D. Repeat cytology in 6 months. The answer is C. Repeat cytology in 1 year. ASCUS or LSIL in women aged 21-24 should be managed by repeat cytology in 1 year. Neither cervical conization nor LEEP, loop electrosurgical excision procedure, would be appropriate in a patient of this age or presentation. What follicle-stimulating hormone, FSH, and luteinizing hormone, LH, levels would be present in a patient with premature ovarian failure? A. FSH greater than 120 micro-international units per ml and LH greater than 80 micro-international units per ml. B. SH greater than 25 micro-international units per ml and LH greater than 40 micro-international units per ml. C. FSH greater than 40 micro-international units per ml and LH greater than 25 micro-international units per ml. D. FSH greater than 80 micro-international units per ml and LH greater than 120 micro-international units per ml. The answer is C. FSH greater than 40 micro-international units per milliliters and LH greater than 25 micro-international units per milliliters. Premature ovarian failure is the loss of ovarian function in an individual under the age of 40. A FSH greater than 40 micro-international units per milliliters and LH greater than 25 micro-international units per milliliters would be indicative of this condition. What are the signs and symptoms of ectopic pregnancy? A. Cramping and abdominal mass. B. Nausea and diplopia. C. Fundal tenderness and vertigo. D. Abdominal pain and vaginal bleeding. The answer is D. Abdominal pain and vaginal bleeding. The most common symptoms of ectopic pregnancy are moderate to severe abdominal pain and vaginal bleeding. Pain may be cramping or sharp. Bleeding can be heavy and the individual can even begin to bleed into their abdominal cavity. Ectopic pregnancy is not consistent with fetal survival and requires treatment with methotrexate or, in the case of bleeding, surgery may be indicated. A patient tells her nurse that since week 26 of her current pregnancy, she has been experiencing a raised, itchy red rash on her abdomen and chest. This is her first pregnancy. She has never had this before and she has made no other changes in diet, detergents, or lifestyle. Which of the following might describe her condition? A. Urticaria from food allergy. B. Heat rash. C. Pruritic urticarial papules and plaques of pregnancy, PUP. D. Dermatitis herpetiformis. The answer is C. Pruritic urticarial papules and plaques of pregnancy, PUP. The most likely cause of her rash is pruritic urticarial papules and plaques of pregnancy, PUP, a condition affecting about 1 in every 200 pregnancies. While she could be having an allergic reaction, dermatitis herpetiformis or urticaria, or an inflammatory eruption such as heat rash. These are less likely due to their absence before pregnancy and the absence of any significant changes in her diet or lifestyle. How is glomerular filtration rate, GFR, affected during a normal pregnancy? A. Decreases by 15%. B. No change. C. Increases by 15%. D. Increases by 50%. The answer is D. Increases by 50%. In the average normal pregnancy, the GFR increases by upwards of 50%. This correlates with an overall 50% increase in blood plasma volume. The term placenta previa describes which of the following conditions? A. The placenta separates from the uterine wall. B. The placenta develops before the uterine lining is mature. C. The fetus is inferior to the placental position. D. All or part of the placenta is positioned between the fetus and the cervix. The answer is D. All or part of the placenta is positioned between the fetus and the cervix. In placenta previa, the placenta develops in such a way that all or part of it is positioned in the lower one-third of the uterus, placing it between the fetus and the cervix. This can cause the placenta to tear and bleed. The most common sign is painless vaginal bleeding in the third trimester, generally after week 32. A 25-year-old female primigravida presents to the clinic for a prenatal visit and is concerned with new onset skin changes she has noticed lately. The nurse caring for this client is aware that there are several skin changes associated with pregnancy. All of the following are skin changes associated with pregnancy except dash. A. Palmar erythema. B. Subclinical jaundice. C. Chloasma gravidarum. D. Heger's sign. E. Linea nigra. The answer is D. Heger's sign. Heger's sign is indicated by a softening of the portion of the uterus between the uterus and a portion of the cervix. The remaining choices are all examples of various skin discolorations commonly associated with pregnancy. The nurse advises a woman with mild preeclampsia to do all of the following except dash. A. Check blood pressure often. B. Limit water intake. C. Weigh herself daily. D. Measure the protein in her urine. E. Keep track of fetal movement. The answer is B. Limit water intake. It is not necessary to limit water intake in women with preeclampsia. It is important that women with preeclampsia drink at least 8 glasses of water per day. The ingestion of water may even help reduce swelling. Checking blood pressure and body weight frequently are important in tracking fluid levels. It is also important to keep track of fetal movement and notify a provider immediately if decrease in movement is noted. Women who are preeclamptic may spill protein into their urine as a result of malfunctioning kidneys. The ideal position for a pregnant to lie on the bed. A. Have the mother raise her legs. B. Turn the mother on her right side. C. Turn the mother on her left side. D. Place the mother in Trendelenburg. E. Place the mother in the tripod position. The answer is C. Turn the mother on her left side. Placing the mother on her left side can increase placental blood flow and increase the baby's oxygenation. Placing the mother on her right side, in Trendelenburg, head down, in the tripod position, sitting forward, hands on knees, or with her feet in the air is not of equal benefit. Which of the following assessments is not a focal point of the postpartum assessment? A. Bonding, including maternal, fetal and family dynamics. B. Fundus, including height, location, and consistency. C. Vital signs, including blood pressure and pulse. D. Stool assessment, including consistency and color. E. Lochia, including color and volume. The answer is D. Stool assessment, including consistency and color. The postpartum assessment includes vital signs, blood pressure, pulse, fundus, location, height, consistency, lochia, color, volume, urinary output, measure first void, and bonding between the mother and infant. The postpartum assessment is valuable because it allows for nursing interventions at warning signs of postpartum complications, including infection, hemorrhage, and uterine atony. Stool assessment is not a vital part of the postpartum assessment because it does not lend information to the assessment of potential danger signs. Which of the following ethnic groups should consider genetic counseling for thalassemia? A. Native Americans. B. Northern Europeans. C. African American. D. Mediterranean ancestry. E. Jewish. The answer is D. Mediterranean ancestry. Thalassemia, an inherited autosomal recessive blood disorder, is characterized by an abnormal form of hemoglobin. Those of Mediterranean ancestry may be carriers of the disease and genetic counseling is recommended. African Americans are at risk for carrying the gene for sickle cell disease, another inherited blood disorder that alters the form of hemoglobin. Northern European descendants of Jewish ancestry are at risk for carrying Tay-Sachs disease, a rare, inherited nervous system disorder. Native Americans are not commonly at risk for passing on genetically inherited disorders. How can endometriosis affect fertility and miscarriage rates? A. Decreases fertility and increases risk of miscarriage. B. Increases fertility and decreases risk of miscarriage. C. Decreases fertility and decreases risk of miscarriage. D. Increases fertility and increases risk of miscarriage. The answer is A. Decreases fertility and increases risk of miscarriage. Endometriosis will increases risk of both infertility and of miscarriage. This may be due to a paracrine effect as hormones are released locally by ectopic endometrial tissue, causing disruptions in hormone levels required for implantation and for sustaining an implanted embryo before the formation of the placenta. Endometriosis is more common in the presence of what food allergy-related condition? A. Lactose intolerance. B. Anaphylaxis. C. Endometriosis is unrelated to any type of food allergy. D. Celiac disease, gluten allergy. The answer is D. Celiac disease, gluten allergy. In a study surveying 120 women with endometriosis, the prevalence of celiac disease, an autoimmune condition triggered by ingestion of gluten, was nearly 4 times higher than the general population. No association has been made between the presence of endometriosis and lactose intolerance or incidence of anaphylaxis.